osteogenesis imperfecta is a rare birth defect, which is, of course, genetic, and is characterized by bones that are poorly formed and therefore they break very easily. Between 85 and 90% of all cases are caused by dominant mutation in one of the two main genes that have been identified so far. So, this gene is responsible for type 1, type 2, type 3, and type 4 osteogenesis imperfecta cases. There are other types of this disease that are caused by recessive genes that are yet to be identified. So far, type 2 osteogenesis imperfecta is the most severe form of the disease. Patients with this type of disease display symptoms such as severe bone deformities and abnormal development of the respiratory system and may die at birth or soon thereafter. Because at least two genes have been identified for this disease, it is safe to say in theory that it could be diagnosed even before the woman conceives a baby. However, it is much more complicated in practice, and the reason is that because we have different types of genes, and most importantly, the fact that there are recessive genes also responsible for this disease, being able to track these and of course all the other genes is much more complicated. So what can we say about this disease for the future? In fact, modern biomedical technology has made several important advances, and one example is that certain rare disease genes have been specifically targeted for treatment. The results are very promising. It is therefore hoped that one day diagnostic tools that are able to identify all forms of the genes, or for that matter any other rare disease, could be developed and therefore ease the suffering of victims.